development. In this session, we will examine the importance of effective governance in achieving equitable and inclusive development for all. This session includes the following esteemed speakers: Dr. Arkan Seblani, Regional Chief Advisor and Program Manager at UNDP Arab States, Anti-Corruption and Integrity; Dr. Nima Abid, WHO Representative, Egypt; Dr. David Wilson, Program Director, Health, Nutrition and Population, World Bank; and Mr. Simon Holland, Global VP, Global Marketing, Organon. This session will be moderated by Ms. Sarah Hariz, Policy Lead at Meta.
Hello, everyone. Thank you for that introduction, and thank you for all being with us here this afternoon. It's my pleasure to be moderating this discussion on getting governance right for sustainable, equitable, and inclusive human development. We know that governance is the foundation upon which progress towards sustainable development is built. It's not just about policies and institutions. It's about systems that work for everyone, leaving no one behind, especially those who are underserved, such as women and marginalized communities. Today, we'll discuss some of the key governance challenges and explore the intersection between governance, sustainable development, health equity, and inclusivity. We'll also look at how governance can drive equitable access to healthcare and the role the private sector can play in advancing this agenda. We're fortunate to have our experts with us from UNDP, WHO, World Bank, and Organon, who will share their insights and discuss where we need to focus most to drive sustainable, equitable, and inclusive human development. So to start the discussion, Dr. Arkan, I'm going to turn to you. Can you tell us a bit about how financial structures and governance frameworks influence the ability to deliver inclusive human development, and specifically in healthcare?
Thank you, Sarah. I'd like to start by thanking the organizers for putting together this wonderful event and for bringing back the issue of health, linking it to development as a priority that is not only important for this region, this country, but globally. And for actually creating space to talk about governance of in the health sector. To respond to your question, I go back to pretty much every single meeting I've ever had with a health minister around the world, in the region and beyond. And they always say the same four things. When asked or when we discuss the issue of how can we promote health outcomes in the country. And then the first thing they say, we need to modernize our laws. Some are old, that we need to really revisit the legal frameworks. Second thing they say, we need to digitize the health sector. Third thing they say, we need to train people more. And the fourth thing they say, we need more money. And this is extremely interesting that every single minister in every country, notwithstanding their economic model, political system, they do share all these common needs. And the thing is that a lot of these are essentially about governance. Reviewing the legal frameworks is a governance issue. To make sure that roles and responsibilities are distributed properly, that checks and balances are built into the system, that requirements of transparency and accountability are embedded into the laws, that the institutions themselves have the capacity to carry out these, implement these laws and regulations. Digitization similarly as well. Digitization is not just simply about automating documents, basically taking what's on paper and putting it on a screen. It's really about a process of rethinking the processes, the services, of re-engineering them, and of digitizing them, which is way more than just automation. So again, it is a governance issue. Also, within digitization, it's not a panacea, although in today's world, everyone, and there's this kind of consensus that, digitization, we need to move and do that. It's going to be the silver bullet for the problems that we, or the challenges. While it is true that digitization can bring a lot to the health sector, but it's not risk-free. It needs to be governed well. So the governance of digitization itself is another issue. Third, when we talk about training and building capacity, similarly, it is a governance issue. And last, and the fourth, financing, which might look like a financial and economic question, but effectively, it has a very important governance dimension because one needs to build trust in the institutions to be able to attract investments, to be able to bring in the private sector, which naturally is concerned about the bottom line as well. True, it has social corporate responsibilities, it has all these big, ambitious, let's say, commitments, but at the end of the line, it's the obligation and the duty of the private sector to also profit and pay dividends for the investors. So they need to be assured that risks also are under control. So if we look at those four asks, governance is part and parcel of every single one of them. The question becomes, and I'll finish with that because I realize we'll be coming back with more questions and discussion. I'll finish with one last idea, is that governance is not simply the job of governments. Governance is not simply the job of governments. It requires a whole of society approach. True, the government regulates, even is involved in service delivery in a lot of aspects, but creating the spaces for private sector dialogue and engagement is critical, is part of the governance agenda. And by doing that, you help with human development, you help with health outcomes that contribute to human development, civil society as well, especially in crisis situations, in reaching populations that are, of particular, let's say, needs that maybe the government cannot reach in certain cases, making them part of the governance discussion and dialogue and efforts is important. So governance is not just the government's job, they are the key player, but private sector and civil society also need to be part of it. And that's where we have SDG 3 of the Sustainable Development Goals linked to SDG 16 on peace, justice, and strong institutions. And this marriage between those two goals is really at the center of the whole of the Agenda 2030 and the 17 Sustainable Development Goals.
Thank you so much, Dr. Arkan, for that remark. And I like how you placed it at the core of all the asks that are coming through. All these things that these ministers of health that you're sitting with that are asking for, they're all essential. But that governance piece comes at the center of all of that. So thank you for framing it in that way. And I think we know this doesn't come without challenges, right? So it's a nice little segue for me to turn to you, Dr. David, and get your perspective on what are some of the maybe wider governance challenges that you have encountered in the Middle East, North Africa region, and what do we do to overcome those?
Yeah, sure. Thank you very much, Sarah. Human development outcomes in MENA went from bad to worse.
I think you might need to bring that a bit closer.
Sorry, is that better? Yes. Human development outcomes went from bad to worse in MENA after COVID. And governance is clearly central to regaining lost human capital. And I think the governance challenges are both fundamental and technical. And I think the fundamental challenge, to use a phrase that our former Egyptian vice president for the MENA region used, we have to renew the social compact between society and citizens in the region. Because compared to other regions, MENA scores lower on voice and accountability, on government effectiveness, and on management of corruption. And addressing these requires root and branch renewal of the social contract between society and citizens. At the next level, there are a range of technical challenges, economic and fiscal. And just take two economic challenges. The share of state involvement in the economy is far larger in MENA than in any other region. 20 to 30% versus 5 to 10% elsewhere. And anti-monopoly legislation is far weaker in this region than in any other region. And to address these factors, we really advocate comprehensive competition reform, much greater transparency of state-owned enterprises, and a much greater focus on an open level, anti-monopolistic playing field that the private sector can fully engage in. And when we turn to fiscal challenges, the one I would highlight most is that the tax to GDP ratio in MENA is far lower than in other regions. MENA typically collects about 10% of GDP in tax versus over 30% in other OECD countries. So improved tax administration and greater allocation of increased tax resources to pro-poor policies is absolutely essential if we are to have the resources we need for human development in this region. Another point I would touch on from a fiscal point of view is the quality of public investment. MENA's public investments are typically 60% efficient at best, compared to over 80% in advanced economies. So much greater transparency about project selection, implementation, and monitoring is going to be critical if we're to grow and free resources for human development. So let me just summarize by saying that a renewed social contract, a much more open and competitive economic environment, and more effective, equitable, and pro-poor tax policies are essential if we're going to create the space for improved human capital. And in my next remarks, I'll touch a little bit about the specific governance challenges in the human development sector. Thank you.
Thank you so much, David. And I know it's far more complex than what you've described, for sure, but I appreciate you trying to make that simple and comprehensible for us. And I'd like to dive a bit deeper into the healthcare element of this and turn to you, Dr. Nima. Can you talk to us a bit about what are the governance challenges you've observed in ensuring universal healthcare, and how do they impact health equity?
Okay. Thank you very much, Sarah. Actually, yesterday we attended a very, very interesting session on governance. And when they were speaking about governance challenges, Hunter, he said, there are no challenges. There are conceptual realities that we have to deal with. I like that expression. In Egypt, actually, there was, ongoing reform, starting with since long time, but recently in 2018, the National Health Insurance Scheme and segregation of activities, now you have separation of service provider from purchaser from regulator. And that's why that followed by institutional reform and having Egyptian Health Authority for service provision. You have Health Insurance Authority, purchaser, and you have GAHAR, or General Authority for Accreditation and Regulation as regulator. So now Hunter is not here, I can use the challenge. It's good to have this. And even in the couple of months, we had workshop on governance or sustainable governance. And the minister himself, the Deputy Prime Minister, he said that the concept is very good, but should not lead to separation. So now what is needed actually, how it's like orchestra, and you have different and several players. And it was mentioned also, and I'm quoting from yesterday as well. You have very strong performers. But at the end of the day, you need the conductor who orchestrates all these performers to end up with music, beautiful music. And for healthcare, this, to be honest, is a quality of care that the patient is receiving. So to reach all that is really need to how to link all these different pieces into one masterpiece. And here the orchestra conductor is the Ministry of Health of Population that is leading on all these. When we come to the governance, the most important is really governance at the lowest level, at the contact between the patient and service provider, because there what it does matter more. And the good in Egyptian system that you have in each facility, you have almost health insurance unit that can ensure that there is some kind of governance. And now, with the development of clinical guidelines to standardize the treatment, whether the patient is treated in Ain Shams or treated in Aswan or treated in Sohag, so he will receive the same standard of treatment according to the standardized national guidelines. This is extremely important to ensure clinical governance. So there are many challenges, and there are need for to review actually legislation, regulations, and so on. But at the same time, there is really progress in Egypt in ensuring governance and aiming at improving health service delivery. Thank you.
Thank you so much, Dr. Nima. That's some really interesting remarks about how you overcome, I think, some of those challenges as well, and highlighting, I think, from the start that this is the context, right, that we live in and how we navigate through. But it's important, the points you're making about all the progress that has been made already and the outcomes you want to see. Thank you. I might go a little bit deeper into health and turn to you, Simon, with your perspective from Organon and focused on women's health, and just understand a bit your perspective on how some of the targeted investments in women's health can drive sustainable growth and innovation, and what areas of women's health specifically hold the most potential for impactful change.
Great. Thanks, Sarah. And can I start to just say how fantastic it is to be here today in Egypt this week. I'd also want to thank the organizers for the opportunity to be here today on the panel to talk about such an important topic with such distinguished speakers. So thank you. Maybe just a quick moment about Organon. Organon, as you mentioned, is a global healthcare company with a specific focus on improving the outcomes of women. Our mission is a better and healthier every day for every woman. And so at Organon, we are very much in tune in focusing our investments into women's health. But we also believe that this is a strong economic imperative for governments and countries as well. We think that this investment shouldn't be seen as a cost, but an investment in driving broader economic impact. However, the fact remains that we need far more innovation in the area of women's health, innovation that can help us tackle the many unmet medical needs in women's health, including the very high rates of unintended pregnancy that we see around the world. While amazing progress has been made in this space over the past decade, we still see far too many women that do not have access to highly effective modern contraceptive options. And as a consequence of this, we also see that nearly half of all pregnancies worldwide are unintended, and that's about 121 million pregnancies a year. And when this happens, when a woman can't decide to when she will start a family and how many children she wants, this has a significant impact on her. It impacts her ability to stay at school. It impacts her ability to advance her career, and it impacts her work life. It also, beyond the individual, we see that it impacts her broader family, it impacts her community, and it impacts the country's economy. In fact, what we've seen in research is that for every $1 invested in family planning, we receive $120 in benefit, whether those are improved health outcomes or economic benefit. Now, turning to the pharmaceutical industry, unfortunately, only 4% of all R&D or research and development spend by pharmaceutical companies is in areas and conditions that are unique to women. At Organon, we're hoping to change this, drive an increase in the amount of investment into women's health. And as a result of this, we believe that this can drive improved, reduced healthcare costs, better quality of life, and a more productive workforce. With regards to your specific question around what areas of women's health I see have some of the greatest areas of impact, I would point to a challenge that many countries around the world are facing, and that is that they're seeing significant drops in fertility rates at the same time that they're seeing very high rates of unintended pregnancy. This is particularly of concern in Asia Pacific, where you see countries like, and large economies like Japan, China, that are forecasting that they'll see a decline in their populations over the coming several decades. And of course, this is expected to have a significant impact on their economies. I would point to some solutions though. APEC Smart Families is one example. This is where private and public sectors came together to develop comprehensive policies that support the reproductive health in this area, and it's pleasing to see that those 21 APEC economies are beginning to implement on those policies. And it's a great example, I think, of showing how you can develop policies that can tackle these very complex issues around fertility and unintended pregnancy, but policies that take into account the goals of government, the goals of the private sector, but also the goals of women and society in general.
Thank you so much, Simon. And I like how we've taken this conversation through different levels, where we've looked at the impacts on individual women and how that cascades across to their families, societies, and the broader economies. And this theme of governance flows all the way through from the higher level all the way to individual patients. So thank you for bringing in that element as well. And that brings me back to you, Dr. Arkan, to take us back to that higher level again. Can you tell me a bit about how governments and multilateral organizations can build stronger accountability mechanisms?
Thank you. So accountability, that's a big word. And I mean, it's quite difficult to discuss accountability today in these times when health facilities are being war targets in this region. But setting that aside for a moment and thinking more holistically and globally, accountability in the health sector is part and parcel of the governance agenda, of course. Governance has different dimensions, and accountability being one. And it has to be at different levels. It is not just at the level of the interface between the patient and the service provider, although that's absolutely the most important, like the panelists have said. But it's also even at the highest level of policy setting, because you can be developing policies at the high level and without the appropriate safeguards, that policy can legalize and formalize corruption or abuse if there is no accountability. So it's very important to consider accountability as something that has to flow from the highest level of decision making to the lowest level of interface with the patient. And then throughout these different levels, it seems to me that when there is discussion on governance in the health sector and accountability, that the discussion kind of gets stuck at one level, which is how we restructure the sector, how we distribute, how we merge bodies together, how we separate bodies together, and how we maybe separate, regulation from service delivery, the purchaser, these kind. And this is very important. This is an important part of accountability, is to make sure there is segregation of duties, checks and balances, and there is no conflicts of interests that are structural and legalized, like I said. But it seems to me that most of the discussion stops there or is focused there. Of course, there's another dimension to accountability, which is the obvious dimension of building capacities for public officials, for administrators, technical people, to make actually accountability and governance part and parcel of their training, even though they are not necessarily a lawyer or an administrator. And this is an effort that's being done, for example, here in Egypt with the National Anti-Corruption Academy, that is trying to build programs for health officials on anti-corruption and integrity and accountability, so that it can be part of the thinking and the mindset of people working in the sector, regardless of whether that's their primary responsibility or not. And then there's the third level or third dimension, which is necessary for accountability, is to make sure that there are safeguards against abuses, proper prevention. Just like medically speaking, an ounce of prevention is better than tons of cure. Similarly, in accountability, an ounce of prevention is much more important than enforcement, not in terms of the importance, but in terms of the return on investment. Because once the problem happens, okay, you're going to run after the person who made the mistake to try to hold them to account. You might succeed, you might not, administratively or legally, judicially, and it will take years to get a conviction. That is, if you get a conviction, and then anyway, the damage has been done. So accountability is about also prevention and making sure there are proper safeguards against abuse and misuse of powers. And this is essentially, prevention is essentially about risk management. Is essentially about risk management. To prevent something is to make sure that something that might happen and we don't like it to happen doesn't happen. That's prevention. And risk management is exactly that. So when we look at risk management models in the health sector, we see a lot of room for improvement to account for accountability risks, including things like corruption, including things like waste. And this is relatively new globally. Together with WHO, UNDP has established a global network on anti-corruption, transparency, and accountability, which is based in Geneva, but tries to support accountability as part and parcel of this agenda through research, through country-level work, and through networking and capacity development. UNDP has worked hard in the last 4 or 5 years to support the integration of corruption risk management, which is an essential, like I said, accountability mechanism, into the health sector. There was maybe resistance, evasion, lack of understanding in the beginning, but we are seeing this take root. Today, in this region, Tunisia is doing it, has made progress and showed that this actually has it's not accountability for accountability, it's accountability for health outcomes. It showed how investing in accountability can enhance health returns on this investment through better health outcomes. Palestine, despite everything, has started doing it, and they have shown results in relation to insurance, health insurance, just like Tunisia did on service provision in public hospitals and the supply chain of medicine. Egypt is engaged in the discussion on this, Jordan as well, and it's bringing the accountability bodies, and I would like to close with this idea, together with the health authorities. Mm-hmm. Just like I said in my first intervention, that governance is not just the job of governments, accountability is also not the job of one entity. It requires the accountability bodies and the health authorities to come together. And this is easier said than done because everyone has their own language. So creating spaces for them to come together, and that's what governments can do, and that's what multilateral organizations can do. They can create these spaces for the health community to come together with the accountability community to build a common language, and then finally to ensure that in their own programs, this is part and parcel of their support to health. That support to health cannot be devoid of support to accountability in health, and support to accountability of health cannot be devoid of corruption risk management and accountability risk management. Thank you.
Thank you so much. I've been told that we've been racing through. Good to go? Okay, sorry. Sorry about that. Really great points. I think what you were saying about that intersection between accountability and healthcare outcomes is critical. Ultimately, the objectives are the same. You want to reach improved healthcare outcomes, and to do that, like you were saying, you focus on the cure rather than the prevention. So coming together to create that space from the beginning makes complete sense. But it's not obvious from the beginning, isn't it? So it's that journey to get to that end point.
And what's encouraging that we are seeing it start to happen. And we hope that can take root and become more the rule rather than the exception.
Absolutely, I agree with you. And that I think Dr. Nima will be able to maybe expand on even a little bit more, and to give us your perspective on how health governance systems can become more responsive to local communities' needs, especially in ensuring that populations have access to healthcare.
Would you please repeat that?
Wanted your perspective on how health governance systems can become more responsive to local community needs, especially in ensuring populations have access to healthcare.
Thank you very much. I'm sorry for
echoey in here, isn't it?
Yeah. Thank you very much. Actually, it starts from economic policies. I mean, because health and economy are reinforcing each other. So if we start with responsible economies, I mean, socially inclusive, considering the health and education especially, and considering equality, equity in the planning process, that really would lead to more investment on health. Because now in Egypt, I mean, the spending on health compared to the GDP is less than the constitutional. Let me say constitutional. What's written in the constitution, constitutional commitment. Sorry for that. This is one. Second, to me, the most important to ensure equity and reach people at all levels. The health system in Egypt need to be more decentralized. Community engagement is extremely important. Decentralized, or we can say localization. We have a proverb in Arabic. We are saying "Ahl Makkah adra bi shi'abiha," which means that the people of Mecca, they know Mecca better than anyone else. So those really are the periphery, not only at the province, even at the district level. They do know what are the details there, what are the needs, and community also, the community themselves, they know their priorities. So there should be systematic engagement of those communities really to ensure that we are reaching those most vulnerable. I can give you an example now. The great achievement of Egypt in being the first country in the world that have reached golden status and on the path to elimination of hepatitis C. So coming down from more than 10% to 0.36%, which is a great achievement. But now what is remaining? What is remaining? How to sustain that achievement? What is remaining is the prevalence among key population, I mean, especially drug users, injecting drug users. So how can we reach those? Another example, for example, when we speak about TB, tuberculosis. Tuberculosis in 2020, only 1% among refugees. 2023, 11% of the cases detected in Egypt are among refugees. So how to reach those populations? So we need to engage, actually, the best approach maybe, to engage people from within those communities to reach them. So I think there is a need for more decentralization, more engagement of the communities, and to ensure equity and the more equity in the health system, and to sustain the great achievement that have been reached so far, especially in the public health system in Egypt is really, and the preventive department, they are very strong. Thank you.
Thank you so much, Doctor. And I think they're really incredible points. Like, we all know of the example of hepatitis C in Egypt and the amazing outcomes they have seen, and targeting specific communities is not easy, but that's, you know, the approach that you need to do, and decentralizing that system is critical. And I'll come back to you actually now to dive a bit deeper, Simon, about the role that private sector can play in ensuring sustainable health outcomes for women. And what are some of the policies governments can adopt to address disparities in access to reproductive health care services specifically? So going back down to that detail.
Sure. Thanks, Sarah. So I think the main point that I'd want to communicate today is that no single organization can transform women's health. It needs a multi-sector partnership approach to drive change when it comes to ensuring sustainable health outcomes for women. And I am biased, but I strongly believe that the private sector has a huge role to play here. A good example is a few years ago, Organon introduced the Her Promise Access Initiative. This is Organon's commitment to help prevent 120 million unintended pregnancies by 2030. And we do this by ensuring cost-effective, modern contraceptive access to over 100 million women in 69 developing countries. And I'm happy to be here today and say that at this moment in time, we're past halfway in achieving that goal. However, I would say all the success of that initiative has been driven through partnerships. It's through strong partnerships with highly committed governments. It's with strong partnerships with many other organizations in this area, too many to name, but include obviously UNFPA, USAID, and many more that are helping us achieve those goals. And what I would also say that it requires to be successful, not only the expanding of access to affordable, highly effective modern contraception, but it also comes with expanding access to accurate information, information for women, for physicians and other healthcare providers. And it also requires a real commitment to training to healthcare providers to make sure that ultimately women and girls are able to make informed decisions around their reproductive health. And so I think this success drives our belief that at Organon, if we can align our business strategies with the goals of sustainable development, then we can deliver innovative healthcare solutions in ways that can reach countries that can most benefit from these.
Thank you so much, Simon. And I think that's also spoken a bit about how to reach those communities that Dr. Nima was talking about, and how to provide the services that are needed where they're needed most. So thank you for focusing on that. And you touched a bit on tackling misinformation.
Yeah.
So I might stick with you for the next question and just get some more insight from you in the context of women's health. How can the pharmaceutical industry support tackling misinformation to ensure that women really do have the information that they need to make accurate decisions about their healthcare?
Yeah. Thanks for the question. Yeah, so unfortunately, misinformation, it's a major challenge within women's health, and I think one that's only getting worse. I think social media is only making that worse, and as a result of that misinformation, it's stopping millions of women from accessing, from starting, from continuing very important women's health products, including contraception, but also we see that in menopausal health and many other women's health areas. I think working with communities and partners around the world, at Organon, we're trying to educate women and healthcare professionals to provide accurate, comprehensive information to support women to make informed and empowered choices and decisions. For example, when it comes to choices around reproductive health, we see these as deeply personal and individual choices, and these should be decisions that are made and supported with accurate information. I think it's critical as a pharmaceutical company and pharmaceutical companies to work closely to partner with governments, with NGOs, and other healthcare professionals to tackle this misinformation and empower women. Finally, I would say that increasing access to accurate information can help ensure that women everywhere can be informed on decisions around their reproductive health. And at Organon, we very welcome continuing to work in this space with all of our partners.
Thank you so much, Simon. I think we've touched on a number of levels, as we said. We've looked at the broader governance structures, the framework, some of the challenges, some of the ways forward. David, if I can turn it back to you and ask your perspective on what are the reforms that are most urgently needed, especially in human capital, which is an area that you're focusing on, to ensure that we can have that sustainable, equitable, and inclusive development.
Thank you very much, Sarah. I think it's worth beginning by saying that the World Bank's Human Capital Index shows that a child born in MENA is only 59% as productive as they would be if they received full health and education. In other words, over 40% of their potential is squandered. And I'd like to take specific examples from education and health, which illustrate the governance challenges. In education, despite very high enrollment ratios in the region, learning outcomes lag other regions. 59% of children aged 10 in MENA can't read or understand a full sentence, compared to 48% globally. And to redress this, we really need improved education governance, including an aligned vision at every tier of educational leadership in the region, improved teacher recruitment, training, motivation, remuneration, and retention, major curriculum reform, and much greater accountability in the education sector. In health, we've had some excellent discussions of health issues in the region, and I think it's worth highlighting that out-of-pocket spending in this region is 38%, far higher, double in fact, the global average of 17%. And so it can be prohibitively expensive for citizens in MENA to secure good quality health care. And to change this dynamic and to harvest the benefits that colleagues have spoken about, we really need to focus on comprehensive universal health coverage, financing, and service delivery reforms so that we have strong public health systems that provide good quality services for all citizens without requiring themselves to go into debt or potential bankruptcy in order to pay for healthcare. And I would just close by saying, as I said earlier, we have many of the technical interventions that we need in order to do this, but improved governance, at all tiers is the lever that we all need to pull together if we are to be able to deliver these technical interventions. Thank you.
Thank you, David, and thank you for highlighting that and summing that up and what we need to have improved health outcomes and improved education as well. And although you've given us that summary, I do like to wrap up with what I like to call a rapid fire round, because we cover a lot of content, and we definitely did in this panel. So I think the audience has had a lot to absorb. So I'd like to kindly ask you to give us one key message, something you either want the audience to remember or a call to action for everyone. And we'll just go along our panel. So I'll start with you, Dr. Arkan, Dr. Naama, David, and Simon.
All right, let's see. So achieving health outcomes in a manner that contributes to sustainable development, to human development, requires putting governance at the heart of health reform and health programs. This doesn't mean that we stay at the just one level of governance, that we need to go on different levels and to put accountability at the center of governance efforts, bringing together government, private sector, civil society to create spaces for interaction, for joint thinking on solutions, and for risk management, because without risk management, we can't do prevention, and prevention is better than cure.
Thank you.
Thank you very much. My key message is to invest more on data and data quality, because this is extremely important. And the launch, and I mean, you have seen the launch of the National Health Strategy. One of the major pillars is health information system, digital health, interoperability between different systems, because only with that we would have, data-driven planning. We will have measuring. We can measure the progress, and we can have meaningful accountability, and we can also measure whether the governance system, whether institutional or clinical, are working or not. So it's just by having data and investing more on data analysis and use of data at the lowest possible level, at the level of data collection. Because unfortunately, we sometimes use the data just to submit report to the higher level. But if we use the data at the level of data collection, then the quality of data will be improved, and the governance of data will definitely be improved.
Thank you.
I think anyone familiar with MENA citizens inside or outside the region will know that they're too talented, energetic, and resourceful for the positions that so many find themselves in. We have far too much wasted human potential and human capital in this region. So let's draw on the ancient strengths of what was the Fertile Crescent and the cradle of civilization to renew the social compact in a way that allows all MENA citizens to flourish wherever they find themselves at home in the world.
Thank you. Simon?
Yeah, sure. So I'd start with Organon is deeply committed to ensuring sustainable health outcomes for women. And the way that we do that is through innovation and through partnerships. Over the last 60 years, Organon has delivered a huge amount of innovation in the area of women's health. But it's through partnerships that we ensure that those innovations get to women that can benefit most from them. So, I continue to push for even greater partnerships to ensure the success here.
Thank you so much. That brings us. That gives us the conclusion of our panel. I'm not sure if we have any questions. We do have one question. Do we have a mic for the question? Sure.
Mahmoud Daoud from Asharqiya Governorate, Egypt. My question for Dr. Arkan Seblani. How can the local unit authorities do their part to make the governance make the governance localized, or in other words, from your views, how can local authorities, which called in Egypt al-wahadat al-mahalliyya, how are they able to do their parts with healthier work? Thank you.
You take more questions or I answer?
I think answer. If there's another one, we can take it. Was that okay? Yeah, you're okay to answer it?
Sure. Thank you for the question. Would you like me to answer in English or Arabic? أجاوب بالعربي ولا بالإنجليزي؟ Okay. So local authorities, of course, have an important role, just like Dr. Nima was saying, because ultimately they are أهل مكة التي هي أدرى بشعابها. And this means that they need to be part of the governance discourse, and they need to be included. Unfortunately, in a lot of countries, decision-making is very centralized. And it is very challenging to encourage a decentralized approach to identifying challenges and finding solutions. However, if sufficiently empowered, local authorities can be part of that discussion and can bring a lot to the table. So that's one. That's one aspect but it requires enough empowerment for them to be part of processes. But then, on the other hand of the governance equation, they can be part of oversight at the local level. They can be part of social accountability initiatives. They can be part of ensuring that quality standards are being actually respected. And this requires an environment also where there is partnership with civil society, with the local community, with specialized organizations that reach key demographics, whether it's, let's say, drug users or women in rural areas and things like that. And this is where local authorities have also an important role, because they help with the oversight, with the engagement, and with informing decision-making as well.
No other questions, I think. All right. It's been a real pleasure moderating this discussion. Thank you all for the insights that you shared. There's a lot to take away, and I know the audience has a lot to think about with placing governance at the center of this topic. So join me in thanking the panel for being with us today. Thank you very much.
Thank you.